we want to discuss another major criteria in acute rheumatic fever. A major criteria is basically if you see this one and another one, you should just be confirming that there's what acute rheumatic fever. So this is carditis. So carditis in general is just inflammation of the heart. So inflammation of the heart has different components, or you could say layers. So you can find inflammation of one part, two parts, three parts. Do you understand that kind of thing? So in general, they just call it carditis. So this occurs in acute rheumatic fever. So let's relate it to acute rheumatic fever, right? So it is actually one of the major criteria of acute rheumatic fever. Then it can lead to what? Rheumatic heart disease, of course. So it typically affects the endocardium, myocardium, or pericardium. Okay, and the most serious issue is it can actually cause what? Valvular stenosis. It will inflame the valve to the extent that the valve is scarred. Okay, it's no longer flexible. So you can have Pancarditis, which is inflammation of all these three layers. You can have endocarditis, which is inflammation of the inner layers, including the valves, right? You can have myocarditis, which is inflammation of the middle layer. They can have pericarditis, which is inflammation of the what? Outside. Okay, I think I had pericarditis here. All right. So it's just, or you can have inflammation of all those layers. Okay. So when it causes valvular issues, that's inflammation of the valve, scarring of the valve, stenosis. Mitral valve is usually the most frequently affected one. Aortic valve can also be affected. So the thing here is this: when blood flows inside the valve, it's not a one-way flow again. The blood can regurgitate. It can move backward. Okay. So clinical signs is tachycardia. All right. Heart murmurs are now more than the lobbed up. You're having other sounds too. The heart is enlarged on X-ray. Signs of congestive heart failure. So diagnostic tool is what? Echocardiography, just to pinpoint all those irregularities in the heart. Electrocardiogram too. Chest X-rays to see the anatomical disruptions in the heart. Okay, so that's what we got, and that's the link up between carditis and acute rheumatic fever.